Good afternoon, everyone. I'm Ken Wong at the RGP of Toronto, and thank you to you all for tuning in, and to those who are just sort of settling down with their popcorn now. And thank you for joining us on this wintry day, and I think it'd be more wintry for those of you up north compared to those of us in Toronto. Very, very happy to have you join us today. We've delivered webinars. We delivered webinars approximately once a month, and we really cherish being able to invite people from around the province, from around the region, the GTA. Our last two webinars from around the world, we had speakers from the UK and another speaker based in New Zealand presenting. Today, our presenters have commuted all of 15 feet to present this webinar to you. And just by way of introduction, for 7 years, our office, along with partners across the RGPs of Ontario and the LHINs, have coordinated the Ontario Senior Friendly Hospital Strategy. And the time is nigh. In fact, I think most would agree long overdue to facilitate support across the healthcare community, particularly those sectors who may not have benefited so much in the past from support, from education and collaboration that hospitals have had maybe somewhat easier access to. So presenting this work today and launching this philosophy are our Executive Director, Dr. Barbara Liu, our Geriatrician and Executive Director of the RGP of Toronto, and our Project and Quality Manager, Ada Tsang of the RGP of Toronto. Before I turn things over to Dr. Liu and Ada, just as housekeeping, we hope you are hearing us clearly, and if not, there's an email address, Wendy Zay, to contact for support to help you get connected. And furthermore, we really value your contributions and discussion, and you can do so using the chat box on the bottom right of your screen. There's a line right at the bottom right corner where you can enter your comments and questions. And please do so throughout the presentation, and the presenters will find a pause to answer your questions. Without any further introduction from me, I'd like to turn things over to Dr. Liu and Ada.
Thanks very much, Ken. I hope everyone can hear me all right, and I welcome you to the webinar today. It's a really exciting time for us to be launching the Senior Friendly Care Framework. Our outline today is pretty simple. I'm going to start off, and then Ada's going to take over. I'm going to take you through a very brief background on the successes of the Senior Friendly Hospital strategy and why we think the time is right to evolve the Senior Friendly Hospital Framework to a Senior Friendly Care Framework. We'll tell you a little bit about the framework itself, and then talk about what's next in the system in terms of senior friendly care. But first, we'd like to find out who's on the line with us. We see that there are a lot of participants registered. The Senior Friendly Hospital Strategy started in 2011, and it was actually the first, or amongst the first, pan-LHIN collaborative efforts. All 14 LHINs collaborated to form the pan-LHIN Senior Friendly Hospital Strategy in Ontario. So Ken's going to put up a poll so we can just find out which LHIN you're calling in from.
We'll give you another 20 seconds to fill in your answers, and then we'll show you the outcome. So there are the results. They may be tweaking a little bit as we go forth, but comments from the presenters?
That's how it shows. Ken, I'm not sure I can get a full picture here. Is this view the view that everybody sees? It looks like we have a distribution of almost every LHIN here. Oh, that's a little better. Thanks very much. So it's wonderful to see so many people calling in from all over Ontario. Of course, it's a relevant framework because there are seniors everywhere in the system. And so we'd also like to know which sector people are from, or which sector they feel they are most predominantly associated with. So Ken's going to set up a second poll. And you can select all which apply here.
few people are still punching in their answers, but we can see how the horse race there is evolving.
Yeah, that's great. It's great to have many other sectors joining in this conversation with us. And I see that we have one person who is identifying as in the patient category, so welcome.
And 4 in the caregiver.
4 in the caregiver. Thank you, Ada. All right, then. Thanks, Ken. So in 2011, the first Pan-LIN Senior-Friendly Hospital Strategy began, and we looked at an environmental scan. We developed a toolkit, and then we worked on indicators for delirium and functional decline. The second phase of the strategy started in 2014 and is ongoing, and we repeated the environmental scan, and I'm going to show you some of the results from that. So comparing 2011 to 2014, using the Senior-Friendly Hospital Framework, you can see that there was significant progress from 2011, from 2011 compared to 2014. All of the bars on this side of the graph are significantly improved or show progress in the areas of the Senior-Friendly Hospital Framework. So we were very happy with that. What we did next was to build capacity across the system. There was good progress being made, but stakeholders and leaders in the system for Senior-Friendly Hospital were telling us that they felt that they needed some help. And the specific areas where they felt that they needed help related to quality improvement, change leadership, specifically as it applied to senior-friendly care. So with help from the Ministry of Health and a Health Services Research Fund grant, we were able to deliver the Senior-Friendly Hospital Action Program, Accelerating Change Together in Ontario, that was very much modeled on existing quality improvement, capacity building programs like IDEAS delivered by HQO, as well as some of the programs that are delivered by the CCLIPS program at the University of Toronto. We were able to engage 87 hospitals who participated in 90 senior-friendly hospital improvement projects, and those teams from those 87 hospitals included 450 staff, as well as patients, families, and trainees. They worked on improvement programs or improvement projects that the majority were focusing on their 2 priorities from senior-friendly hospital, delirium and early mobilization. And then there were a smaller number of projects that showed some foci outside of those 2 areas in things like feeding, nutrition, falls prevention, skin and wound management, continence management, and then a fair number of projects that were focusing on responsive behaviors as they relate to delirium and dementia care. That program was hugely successful. I think that everyone who had the opportunity to participate in it will say that it was very memorable in terms of both the work, the type of work that they were doing, the collaboration, the coaching that they received from the Senior-Friendly Hospital Action coaches, as well as the faculty that supported their learning. We had top-notch speakers from all over the world joining us, and you'll recognize many of the faces here on this slide. The next phase of work in the Pan-LIN Senior-Friendly Hospital Strategy was to evolve the framework into a senior-friendly care framework. And that's the focus of today's webinar. Just to remind you about the domains of the Senior-Friendly Hospital Framework, there are 5 domains. The first is organizational support, which speaks to how leadership is committed to optimizing the experience for frail seniors in their organization. And the organizational support essentially enables all the other elements of the framework to come to life in their organization. In processes of care, we wanted to see that care was designed from evidence and best practices that are mindful of the physiology, pathology, and social science of aging and frailty. In the emotional and behavioral environment, we wanted to ensure that care was delivered in a way that is free of ageism and respects the unique needs of patients and their caregivers. In ethics and clinical care and research, Care is provided and research is designed in a way that protects the autonomy, choice, and diversity of the most vulnerable patients. And finally, physical environment. This is the structure, space, equipment, and furnishings in the environment that minimize vulnerabilities, promote safety, independence, and well-being. These were the domains and the descriptions of the Senior-Friendly Hospital Framework, and we wanted to build on the success of this framework and the recognition that this framework already had in the healthcare system. We didn't want to abandon the framework altogether. We wanted to evolve it to make it relevant to other sectors in the healthcare system. How is a framework helpful to us? A framework is an essential supporting structure of a building vehicle or object or a system. And we can think of healthcare as a system. And in fact, our original framework, which was focused on hospitals, hospitals in and of themselves are in many ways complex systems. And we have a patient surrounded by their team members in that hospital system, and the Senior-Friendly Hospital helped us work on quality improvement in that setting. But we know that the hospital is not operating in a silo. It is a part of a community and it should be integrated as part of a healthcare system that involves many other sectors and many other providers. So the individual who is cared for in the hospital has an experience with those sectors both preceding their hospital visit as well as after their hospital visit. So that individual is actually interacting with many other teams. This is our patient along with their family and caregivers in the community, interacting with multiple team members from different organizations. Within those organizations, those team members have relationships with each other as well as this individual, our patient, and their family. But what we really need to ensure is that all of those team members are working together across organizations and across sectors to best meet the needs of the individual at the center of the care, our patient and their family members. So the Senior-Friendly Care Framework is building upon the Senior-Friendly Hospital Framework. As I said, we didn't want to lose the momentum that we had gained with that framework. We also wanted the domains of that framework to still be recognizable, but we also did not want to presume that that framework was still going to be relevant to all sectors. We did our due diligence in the process to evolve that framework. We'll tell you about that process in just a minute. Our intention was to develop a framework that would achieve the best possible health outcomes for older adults, fostering improvements in care across the system, and inspiring greater collaboration between older adults, caregivers, care providers, and organizations. So how did we do that? We first went back to the literature. So of course it had to be evidence-based, and we did a literature search looking for frameworks and other organizational structures for conceptualizing how healthcare can be organized. And we looked at literature that was relevant to all sectors of the healthcare system. We identified almost 1,000 articles that we retrieved in full, and we ended up including only 57 of those articles as being relevant to the task at hand. In addition, we identified from the gray literature 25 reports that were relevant to our work. This work was then reviewed by two independent assessors, two reviewers, and then we identified a lot of different themes coming out of this literature. And this is illustrated here in this picture that in some ways kind of looks like a brain, but it shows you how complex the themes were, and the themes did cluster around our existing framework domains: the processes of care, the organizational support, emotional and behavioral environment, and physical environment and ethics. But of course, all of these themes were far too complex for us to position easily in a framework that could be used and adopted by providers in the system. So we went on to then cluster those themes and write them into statements that more clearly reflected the Senior-Friendly Care Framework. And then we asked an expert panel to rate those statements on 3 criteria: whether the statement was important, whether it was clear, and whether that statement fit into the assigned domain of the Senior-Friendly Care Framework. And I'm going to take you through some of those statements in just a minute. Throughout this process, we had an active and robust stakeholder engagement process. So stakeholders, seniors, older people, and their family members were part of this process right from the beginning, and we engaged them in a number of different ways. And many of the people on this call were probably involved in some form of stakeholder input or engagement through this process as well, and we thank all of you for your contributions. So let's look at the framework itself. There were 7 guiding principles that evolved from our engagement and stakeholder process. Those 7 guiding principles are here at the top of this slide, and I think it's worthwhile pausing for a moment to reflect on these. The first 3 items on the guiding principles, supporting resilience, independence and quality of life, compassion and respect, informed and empowered older persons and families, were far and away the most important items in terms of guiding principles from the perspective of older people and their families. The other items on the guiding principles, 4 to 7, were also important, but there was a tendency for healthcare providers to gravitate towards the items at the bottom of this list as opposed to patients and families that really emphasized the items at the top of this list. I think that's an important observation in terms of the input and the contrasting perspectives of patients and families and healthcare providers. As I mentioned before, the 5 domains remain the same and are recognizable from the Senior Friendly Hospital Framework, and we have 31 new defining statements across the domains, and I'll go through those with you now. So in organizational support, many of the items were validated in our literature review. Items that were previously included in the Senior Friendly Hospital Framework still remained relevant when we were applying it across sectors. So it was reassuring to us that those items remained. What did come through, however, there were a couple of new themes or themes that we felt needed to have stronger emphasis in the Senior Friendly Care Framework for a couple of reasons, either because it reflected intersectoral care or because of the evolution of change that's happening in the healthcare system and our understanding and our approaches to care and how it's different from when the Senior Friendly Hospital Framework was first developed. And those items needed some stronger emphasis in this new framework. So I've highlighted those in bold for you on this slide. So some of those themes include promoting older adults' health, dignity, and participation in care. Participation in care as a partner is something that you'll see in several domains throughout the framework. The organization collaborates with system partners. The organization implements standards and monitors indicators relevant to the care of older adults. So there's a movement in healthcare to implement standards and to monitor indicators, but we wanted to ensure that this includes indicators and standards of relevance to the care of older adults. In processes of care, again, many of the items were validated from our previous framework, but some of the items that were new or needed increased emphasis. Care is integrated and provides continuity, especially during transitions. Goals of care are defined by the individual, and goals can be wide-ranging, including recovery from illness, maintenance of functional ability, or preservation of the highest quality of life. Older adults are partners with the care team, and care is flexible and aligned with an individual's preferences. What we're getting at here is that individuals have preferences and their goals are defined by the individual. But at the same time, our care approach to try to help that individual achieve their goals needs to be flexible. So it's not just the fact that the goals are different for each person, but our care needs to be flexible and customized to the individual's preferences and their goals. So the individual preference in terms of the style of the health care that they're going to receive. Now, sometimes this needs to be married with standards that we have in the system in terms of best practice, but very often the flexibility in the care isn't so much a deviation from the best practice, but speaks more to the approach that is being taken in the delivery of that care. Emotional and behavioral environment. Once again, you see some of the same things echoed through different domains of the framework. because they are relevant in different domains. We don't think that some of these things belong only in one domain, but they're cross-cutting throughout the framework. So once again here, care of the older adult is planned and delivered in alignment with their personal goals. Care providers demonstrate competency providing care to older populations with diversity in all of its forms. So diversity, in the past we might have thought only about cultural or ethnic diversity, but we need to think about diversity in many, many domains. Care providers respect each individual's breadth of lived experience, relationships, unique values, preferences, and capabilities. Caregivers are valued and supported as care partners. So caregivers as well as family, however they may be defined by the individual. And finally, social connections are recognized as an important contributor to the health and well-being of older adults. In ethics in clinical care and research and physical environment, there were actually no new themes identified through the process of our literature search. So again, that was reassuring that the Senior Friendly Hospital Framework was relevant and was on target with the areas that they identified as being important in providing care to older adults. And these two domains remain essentially unchanged as we evolve this framework into the Senior Friendly Care Framework. So this framework we think is relevant. When this work first started to evolve, there were several things that were relatively new on the horizon. If you think back to 2015 when the Patients First proposal was announced, Patients First has been around since before 2015, but it took on a new emphasis in 2015. And there were several rapid sequence documents that were released in the province around that time. Gail Donner and her expert panel released the Bringing Care Home report, which I think had a significant impact on the direction of the Ministry of Health and Long-Term Care. And very quickly thereafter, they produced a roadmap to strengthen home and community care under the Patients First strategy. These documents emphasize several things of relevance: access, home and community care, of course, primary care, transitions, caregivers and their role in the healthcare delivery, as well as the dementia strategy also emerged on the scene. Looking more globally, many times when we've been engaging with stakeholders and getting input and consultation in the process of developing this framework, one of the common questions that arises is, how does this framework fit in with the World Health Organization's approach to age-friendly cities? The WHO Age-Friendly Cities has gathered a lot of momentum. As of 2016, there were over 33 countries participating with over 300 members, and it's based on an 8-domain framework, the 8 petals of the age-friendly city flower. And where we see the Senior Friendly Care Framework fitting in is a more significant, detailed view of what's happening in this petal here, community support and health services. The Senior Friendly Care is a higher magnification framework that is looking at community support and health services, because our framework is an intersectoral framework, and it fits in very nicely with the WHO framework, but our framework is not addressing some of these other items that are equally important in terms of well-being, health and well-being of older people in our community, but our framework is focusing on the petal that's just down here, community support and health services. Another international movement that I think people should be aware of is from the United States. 2 large organizations that have a significant profile, including the John A. Hartford Foundation and the IHI, along with several other partners, have spearheaded a social movement called Creating Age-Friendly Health Systems. It's an initiative which hopes to, by the year 2020, have 1,000 age-friendly healthcare facilities in the United States. Their goals are to provide older people with the best possible care, to reduce harm, to increase satisfaction, and to optimize value. some more specifics about what they're asking organizations to focus on. They have 9 high-level interventions that are listed here. They've organized them in what they call the 4 M's. Oops, sorry about that. Let me just move that up there. What matters, mobility, medications, and mentation. Many of you may be aware that the CGS has released the 5 M's in collaboration with the major leaders of the 4 M's movement in the United States. Mary Tinetti and the Canadian Geriatric Society have endorsed the 5 M's, which includes these 4 M's plus multimorbidity. But those 4 M's, the 5 M's, are more of a messaging strategy so that people can understand what it is that we're focusing on in age-friendly or in geriatric services. But the 9 high interventions that they're asking organizations to focus on in many ways overlap with our senior-friendly care framework. Some of the items in this list address issues that we would consider in different parts of the framework. So many of these items are related to processes of care. Some of them are related to the physical environment, like this one about the environment that enables mobility. Some of them are focused on processes of care and in the emotional and behavioral environments, things that I emphasize in terms of patient choice, patients being partners in setting their own goals, having flexibility in the delivery of care. And then other issues related to processes of care are seen in other parts of the 9 targets that are seen here. So thinking about some of the things that are happening in our system in Ontario, understanding that this relates with and is aligned with other initiatives happening in other countries of significance, how can we apply this framework to our work, in our day-to-day work as well as our system in terms of planning and looking towards the future? Well, we can reflect on the current structures we have in place for care of older adults and how they align with the senior-friendly care framework. We can ask older adults and their caregivers to look at the care that they receive and identify how well it aligns with the principles and statements in the framework. And that can become a basis for dialogue between care providers in the healthcare system and older adults and their families and caregivers. Senior-friendly care can also serve as an underpinning for organizational or collaborative QIPs. It can also serve as an opportunity to plan services, to do an environmental scan. And I know that in the Central Eastland, the Seniors Care Network has already applied the Senior-Friendly Care Framework in their review of services as they relate to the upcoming dementia strategy. I'm going to hand things over to Ada to carry on our conversation about what's next.
Great, thank you. We would like to share with you where we're going next with the senior-friendly care strategy. So during our consultations in the framework development process, we asked individuals how we can best support them with putting this framework into action. We've summarized what we've heard into the 6 major categories that you see on this slide. The first category highlighted here is the models of care. So the senior-friendly care framework can help guide the development of new services or programs to support frail older adults. For example, you can think about what kind of models you can develop using the principles of the senior-friendly care framework to support seniors with aging in their setting of choice. The second one, capacity building, refers to developing and strengthening the skills of the sectors across all sectors in senior-friendly care. So some of the ideas highlighted here are workshops, webinars. It also refers to building and sustaining a network of individuals that will collaborate and share knowledge and best practices on senior-friendly care. Right now, we're also looking for opportunities to expand what Dr. Liu previously mentioned, the successful Senior-Friendly Hospital Action Program, so that we could have not just hospitals involved, but providers across all healthcare sectors. We're also working on creating implementation tools that can help individuals put the framework into practice. We are working on the Senior Friendly 7 toolkit for patients and caregivers. You may wonder what the Senior Friendly 7 is. So the Senior Friendly 7 refers to the 7 areas of research that research suggests shows the greatest promise of having positive effects on the lives of older adults. These 7 areas are cognition or delirium, mobility, nutrition, polypharmacy, continence, pain, and social engagement. We're also working on creating a getting started implementation package that could include tools like a self-assessment for priority setting, how to get buy-in from your board or from senior leadership, an overview training module on senior-friendly care, different sample governance structures you could have within your organizations in terms of references, as well as quality improvement tools and resources. The next 2 categories, standards and indicators, are focused on supporting quality improvement efforts. We're looking to create a suite of senior-friendly care clinical standards based on best evidence and quality indicators that can help organizations track their progress and benchmark across organizations. And finally, we are considering the idea of creating a senior-friendly care recognition program that encourages and recognizes organizations that offer an optimal level of care for older adults. And so now that you have heard more about some next phases of work, we'd like to get your help with prioritizing what's most important to you. I asked Ken to put up the poll. Can everyone please select which of the following resources would be most useful to your organization to become senior friendly? You can select your top 3 here. And while we wait for people to submit their responses, I'd also like to hear your thoughts or feedback on any of these areas of work via the chat box. Is there anything missing in what we should be considering next? Is there anything we should keep in mind as we continue our work to create a more senior-friendly system? The 2 questions again for the chat box are, is there anything missing in what we should consider next? And is there anything we should keep in mind as we continue our work to create a more senior-friendly system?
So that's great. We're getting lots of responses on the poll, and it's interesting to us that the recognition program or designation program is coming out relatively low compared to the other things. So I think that speaks to perhaps the participation that we have on the webinar today. I suspect that many of you are health professionals that are delivering care, organizing care, and having more practical tools and things to actually advance your care at the point of care are your priorities, as opposed to a recognition or designation program that perhaps might be more attractive to your hospital administrators or leaders.
Ken jumping in here, or it could just be that we're all humble Canadians.
Yeah, that's a good one, Ken. So it looks pretty even there between capacity building opportunities, implementation tools, standards, as well as indicators. And standards and indicators often go together. So that's terrific advice, and we'll take that away and continue to work on those items.
There's a number of questions that have appeared in the chat box. Shall I leave that poll up while you answer the questions?
Yeah, let me just look through the chat box. So first off, Ian, the York region, several hospitals in the York region have participated in senior-friendly hospital activities, as well as the senior-friendly hospital action program, and we can follow up with you with names and contacts in those hospitals. And there's some excellent suggestions coming up in the chat box about things that need to be included in terms of delivery of care, public health, housing, coordinated care plans, access to care, primary care in the home. And the identification of some of these partners to include, I should have mentioned that that the development of this work has included right from the beginning a broad spectrum of participants from all sectors of the healthcare system. So hospital, community, primary care, long-term care, home and community care, community service agencies, as well as older people and their family members have participated in the work. And we've also sought out representation geographically from various and diverse areas of Ontario. So large and small communities have participated in the work to date.
For the comment about the recognition component, so these are just ideas that we've heard from individuals when we did the consultation. Right now, based on some of the responses from the poll and from what we're hearing, it is probably not a high priority for us in the next couple of years. But if we do go down this route, we will have more details around what this recognition program would look like.
And Sadie Nixon from North Simcoe Muskoka has identified that they have a scorecard that they've been using for senior-friendly hospitals that helps keep them on track. And that might be something that, Sadie, if possible, you could share the headings for that scorecard and the metrics that you use in it. That would be really helpful.
Sadie, my email address will appear on the last slide. You can forward it on to me and I'll distribute to the group.
And Ian is asking about projects to minimize length of stay in acute hospitals and partnering with community care agencies. And I think that that's a question being posed to the group at large. So if people have things that they'd like to share, please feel free. There's a question from NBRHC, will the senior-friendly hospital framework continue, or will it be retiring as we all embrace the senior-friendly care framework? I don't want to say that it will, maybe it will retire. I'm not entirely sure. This is sort of more of a branding exercise. We don't want to lose the momentum of senior-friendly hospital, but I think that it emphasizes the fact that the hospitals are part of a continuum of care. They're part of a system and they're not working in isolation, and that we really need to embrace the idea of care across sectors. So I hope that Senior-Friendly Hospital will see itself as maybe a sub-brand under Senior-Friendly Care. But I think internally, if it works for your organization, if that has traction for your staff, I would encourage you to continue to use the senior-friendly hospital language as well as identity.
With the question about the LIN, I wanted to highlight that we do have a steering committee made up of representatives from all 14 LINs to help us drive the strategy and direction of the senior-friendly care and senior-friendly hospital strategy. So we do have involvement from the LINs, and they are very actively engaged.
And it's Ken here jumping in again on the North Bay Regional Health Center. That was that fancy acronym. Just to shout out to them, as a spin-off to their involvement in the action program, North Bay, if that is Debbie, created their own in-house training program for senior-friendly champions to develop mentors that will help their frontline staff. And mirroring Dr. Liu's comments is the senior-friendly hospital framework on which you built that education will still remain very relevant in the hospital sector. So it still applies completely, but the senior-friendly care framework has expanded the concept so that we can begin to think across the continuum. So it won't make your training obsolete, but this additional information in the senior-friendly care framework will act in addition and over and above that information.
It's great seeing all the interest in the chat box, and please do continue writing in as I finish off this slide. And for those who are interested in getting involved with our work or staying in touch, we do have a mailing list that you can sign up to, and the link is provided up here on the slide. And if you would like to get involved in a more hands-on approach, for example, joining a working group to develop the Getting Started Toolkit, we have a link here where you can express your interest and tell us a little bit more about your background and experiences. Our steering committee will review the applicants and reach out when we have opportunities that align with your background and interests. Are there any other comments or questions? You can put it into the chat box.
Kathy Sturdy-Smith's comments about the Senior Friendly Care Framework promoting opportunities across the sectors. One of the areas that is emerging with the sub-regions, I know that the LHINs are all at different stages of development of their sub-region work, but in the Toronto Central area, the Toronto Central LHIN, the sub-regions have identified quality improvement targets, and I think that are cross-sectoral, so they're calling them collaborative QIPs. And I think that if there was a QIP that was focused on senior care, the Senior Friendly Care Framework could be very helpful to that group as they work on an improvement project. There's a question and people responding about mandatory staff training and senior-friendly approaches. I know that many organizations do have inclusion of senior-friendly material in their orientation package for new hires. And different LMS modules for senior-friendly care that are mandatory in some organizations, not just related to GPA training. GPA training is gentle persuasive approach. Well, people are continuing the conversations in the chat box, and it's really wonderful to see this exchange of information. We've just put up the slide of acknowledgements, and of course, we couldn't include all of the names of all of the many, many people that have contributed to this work, so apologies that we couldn't do that. Many of you on the line with us right now have contributed to the Senior Friendly Hospital as well as the Senior Friendly Care work in the province, and we'd just like to thank everyone for their support as well as their contributions to continuing this work and ensuring that we achieve the goals that we all set out to from the beginning. The work is not finished by any means, and we still have a distance to go. So we want to continue the momentum, sustain the initiatives and the gains that we've had so far. One of the things that I think, especially for the hospital sector, right now this ALC issue is high on the priority list, and there's been announcements about beds being opened and different strategies to address ALC. And someone on a recent teleconference with us said this is the time when Senior Friendly Hospital really needs to step up because people are seeing the solution to ALC as being beds opening and other dollars being invested in other parts of the system to get patients out of the hospital into some other temporary setting. But in actual fact, in the best sort of QI type approach to solving challenges, if you look down towards the root cause of why individuals are having difficulty returning home to the community. It has to do with issues that we need to address through a senior-friendly hospital or a senior-friendly care approach. So I think it's a really important time for us to be really strong and vocal in our organizations about senior-friendly care, whether it's a hospital or anywhere else in the system. Yep, slides will be coming out after the webinar along with an evaluation questionnaire, and we'll also have a recording posted on the website. Another question I'd just like to pose to the group in terms of best ways of interacting. So you saw previously an opportunity to sign up for some of our newsletters. Just wondering what the appetite would be in terms of some type of interactive forum. Do people like using those sorts of forums? Do they, whether you might have had some experience with forums that other organizations have, or do you just find that it's something you tend to ignore? If anybody has any positive experience or otherwise, if they wanted to share that in the chat box, it would be helpful for us to know how to best support this dialogue going forward. Oh, sorry, I just saw the question from Mandy Lindsay about Accreditation Canada, about incorporating some of these standards. Yes, we have had several conversations with Accreditation Canada, and they have expressed an interest in these standards, but they see positioning them in slightly different places other than the traditional accreditation standards that most organizations are participating in. Ada, did you want to comment on it? They were more interested in the designation type of opportunity as opposed to ROPs and standards for accreditation of existing organizations. Mm-hmm. We are, however, in conversation with HQO about standards. Their standards include several standards that are relevance to seniors. You've seen them come out, the hip fractures, behavioral issues related to dementia, and there are several more in the pipeline that are coming out that are relevant to seniors. But we've put in a proposal to have more standards developed for seniors related to delirium, falls prevention, and continence, and hopefully those will be chosen in the next round for development by HQO. Yeah, the HQO interest in the development of standards was really quite exciting, and they were actually talking about it as a senior-friendly suite of standards. So those first three that we mentioned would be the first phase of the suite, and then we would follow up with a second phase, and hopefully we'll see the completion of the entire suite, and hopefully, you know, this could be something that aligns with the Senior Friendly 7 as well.
Mm-hmm. And typically when HQO develops clinical standards, they are all attached with indicators to measure the progress and to compare across organizations. So that may be some of the indicators that you see will be used with senior-friendly care.
So there are a couple of people that have indicated that an interactive form might be helpful. So perhaps we'll follow up with you to just get a little bit more information, follow up with you offline about what might work in terms of interactive forum. Jane, I'm not quite sure I understand your question, Jane McKinnon-Wilson, about linking to some of the HQO indicators related to dementia care in the community. We put in a proposal to have standards developed for those three topics that I mentioned: delirium, falls prevention, and continence. So those would be a complete set of standards, indicators, a patient guide, as well as recommendations for the system. That's how that's the package that HQO develops for each of its standards. So the community care in the dementia care in the community is a separate set of standards, but HQO is very much interested in our work around the senior-friendly care framework.
In the poll, a lot of you mentioned that you are interested in implementation tools. If you can provide us some more insights in exactly which elements within these tools would be most helpful to you, that would be really useful to our planning. So some of the things that we've heard so far is a self-assessment tool to help organizations set priority, having a sample governance structure in terms of reference for committees, providing some quality improvement tools and resources, training modules that organizations can adapt within their setting. If any of these resonate with you, or if you have any additional ideas, please put them in the chat box.
Ken, here jumping in. Along those lines, there was an earlier question, I think it was Tracy, asking about educational tools. And already in the works with our office and colleagues around our network is a Senior-Friendly 7 toolkit. And this toolkit will comprise a number of components, teaching slides that you can adapt in your organization. They're for the 7 clinical modules that Ada mentioned earlier. Teaching slides, some curated bedside resources, easy fact sheets, as well as patient and family materials. And at our annual general meeting, we are hosting, I think, 50 seniors and family caregivers from the community to provide their input on how best to articulate the patient and family toolkit. So stay tuned. The Senior-Friendly 7 toolkit, which will have common areas of common knowledge, but also areas that are tailored for each of the sector across healthcare practice, and areas tailored for different levels of expertise. So tools for healthcare professionals, tools for PSWs, as well as the mentioned patient and family tools. That will be coming in the next few months, and so stay tuned for that unveiling and perhaps for some further engagement to get some of your feedback to help refine this toolkit.
Well, I think that brings us to the close of the webinar. I thank everyone for joining us today. It's a really exciting time for senior-friendly care. Please stay in touch and let us know, number one, what things that we can do to support you in the delivery of senior-friendly care, and also so that we can stay connected as a group, as a collaborative, and continue to have the collaboration across sites from all over Ontario. Over to you, Ken.
Thanks. Well, there's been a whole whack of questions and comments and incredible participation both in numbers and in your activity across this webinar. So we really thank you for sharing in your discussion. We are still here for a couple more minutes if there are last comments and questions. but I just want to bring your attention to a few things to slowly bring us to a close. Shortly, you'll receive an evaluation survey. Please let us know what you think and give us some ideas on how we can improve these sessions. And along with that, it will link you to the presentation slides and a recording of this session. We have a next webinar booked. That's Tuesday, December 12th, also during the lunch hour, and we'll be talking about patient and family engagement in the co-design of senior-friendly care. So two presenters, Dr. Jacoby Elliott at St. Joseph's Healthcare in London, and who also has an appointment at the University of Waterloo, and Kimberly Chetman here at Sunnybrook, who's been doing some patient and family focus groups in designing geriatric care. So we talked about, we'll talk a little bit about an overview of the theory and research on patient and family engagement and co-design. And then Jacoby and Kim will provide two real-life examples of their work in which they've applied those principles. So that's my spiel for next month. We'll continue to answer any questions or comments. And if you have any additional questions, or if you had materials to send us to share to the group, my email address is listed there. Please do, and I'll make sure we all get copies and versions of all the shared resources. And can we give a virtual hand of applause to our presenters, Dr. Liu and Ada. This is representing a lot of work of this organization, as well as many, many partners across the province, and they've been the voice of this work for this presentation.
Thanks very much, everyone.
Thanks, everyone.
I know one of our audience members has raised their hand. We actually don't provide audio in, but if you'd care to type your question or comment in the chat box, we'll be happy to answer.